Good afternoon, everyone. My name is Kevin Haley, and I'll be your moderator for today's webinar. Thank you for joining us. I'm the Environmental Health Specialist for York Region Public Health. And before we get started, I will mention that the lines are muted, and we are now in lecture mode. And if you'd like to ask some questions, please type them in the chat box. And also, to get a sense of who's participating in the webinar today, please add your name and your organization to the chat box as well. And I'd like to take a moment and welcome those who are new to our association to tell you about the Ontario Public Health Association and our Built Environment Workgroup. OPHA is a nonpartisan, not-for-profit charity that brings together a broad spectrum of groups and individuals concerned about people's health. OPHA's members come from various backgrounds and sectors, from the various disciplines in public health, healthcare, academic, nonprofit to the private sector. OPHA's mission is achieved through professional development, information and analysis on issues affecting community and public health, access to multidisciplinary networks, advocacy on healthy public policy, and provision of expertise and consultation. I've been a member of OPHA's Built Environment Workgroup for 10 years, and I've served as previous co-chair of the Built Environment Working Group. Our Built Environment Working Group focuses on influencing provincial policies and initiatives that can improve the built environment and support public health efforts at the local level. We have been involved in issues ranging from strengthening public health and planning working together, linking public health with engineering to active transportation and land use planning. Our work group wanted to hold a webinar series on public health and environmental assessments as we saw the opportunity for public health to influence infrastructure projects for positive health outcomes, and the need arose from a survey we did last year among Ontario public health units. Webinar number 1, Introduction to Environmental Assessments and Role for Public Health, took place on October 24th. Today's webinar will be focusing on building effective public health participation in environmental assessments. I would like to now introduce our first guest speaker, Dr. Sabir Syed, who is currently a Manager of Transportation System Planning at the Regional Municipality of Peel and is Chair of the Urban Transportation Council, Transportation Association of Canada. Dr. Sabir Syed has over 25 years of experience in progressively responsible positions in civil engineering, transportation, and management. Apart from the region of Peel, Dr. Sabir Syed has worked at the City of Markham, the Regional Municipality of York, and the City of Ottawa. Dr. Sabir Syed has a master's degree in civil engineering specializing in transportation from Carleton University, Ottawa, and a PhD from the Royal Military College of Canada, Kingston, Ontario. He is also a registered professional engineer in the province of Ontario. Welcome, Sabir.
So thank you, Kevin. I'm Sabir Syed, Manager of Transportation System Planning at Region of Peel. I will provide broad overview of the environmental assessment process and illustrate with an example. At the Region of Peel, I have the pleasure to work very closely with Peel Health Department. And as Kevin mentioned, I'm also leading a national project on integrating health and transportation through Transportation Association of Canada. I'm on slide number 2. This is an overview of my presentation. I will briefly introduce the environmental assessment and provide definition, key objectives, and discuss various types of EAs. I will present key issues and list number of technical studies that are required. I will illustrate a case study example of the Region of Peel long-range transportation master plan that follows the EA process. Last and most important, how you as a public health professional can contribute to EA. Let's discuss the environmental assessment. The environmental assessment is a process to predict environmental effects of proposed initiative before they are carried out. An environmental assessment identifies the potential adverse impacts and proposes mitigation measures. The environmental assessments are required for various projects such as public roads and highways, railways, transit projects, waste management projects, water and wastewater management projects, etc. It should be noted that the project may or may not go forward as it depends on the environmental assessment impact that are quantified. Many times when I go to a public information meeting, I do hear that it is a done deal, but I must say that it is not a done deal. We have to quantify the environmental impacts. I'm on slide number 4, the environmental assessment objectives. So the EA is a planning and decision-making process so that potential environmental effects are considered before a project begins. So the objective of the EAs are to minimize or avoid environmental effects. Now I'm on slide number 5. You may ask a question, why do we undertake an environmental assessment? Basically, it is the law under federal and provincial government legislation. The Environmental Assessment Act applies to public sector projects, crown corporations, and even to some private sector projects as well. Sometimes private project firms are required by regulation or may voluntarily go through an environmental assessment process. For example, developers, they may build a road and they may be required to undertake an environmental assessment for roads. In Ontario, the main purpose is to protect, conserve, and wisely manage Ontario's environment. And I must say that public consultation is mandatory. The consultations with indigenous communities is an important consideration in the EA process. Now let's look at various types of environmental assessments that are being carried out. First, the federal EAs. They are conducted by federal agencies or crown corporations. Pipelines or railway projects are a good example of federal EA. The provincial EAs are undertaken under Ontario Environmental Assessment Act and applies to public roads, highways, transit, water and wastewater projects. So there are two types of environmental assessments within the provincial part, individual EAs and streamlined EA. The individual EAs are required for large-scale complex projects such as a new highway, for example, GTA West in Ontario. These projects have significant environmental effects and requires ministry's approval. Whereas the streamlined EAs can be used for routine projects that have predictable and manageable environmental effects. Municipal EAs are again classified under class EAs as well as individual EAs if they are required, and they have to follow a municipal engineering association process. And there are other EAs that may have a combination of all of them, all of the above. So for example, federal, provincial, as well as municipal. Slide number 7 just shows an overview of environmental assessment process, and I know it's very difficult to read, but I just want to illustrate that there are 5 phases which we will discuss in our next slide. So there are 5 phases in the environmental assessment process. The first phase is defining the problem or opportunity to be addressed. The second phase involves developing and evaluating the alternative and selecting the preferred alternative. The third phase involves developing the design concept for the preferred alternative. The fourth phase is documenting the study findings in the report called environmental studies report, and last phase is implemented. Now these 5 phases example in particular slide. Before I go to an example, I want to discuss key issues in environmental assessment. The first and the foremost important issue is the property constraint. The environmental assessment impacts the right-of-way and may significantly impact private properties. They may also involve significant utility relocation. Also, the competing interest of limited space comes into picture. For example, the width of lanes, provision of cycling and pedestrian facilities, as well as conflict with various modes such as cars, transit, trucks, and bicycles. And here I see that public health professionals can provide significant interest in this regard to prevent injuries and promote active lifestyle. For example, the noise and air quality is another area where public professionals can contribute significantly. The EAs not only applies to the urban or a built environment, but they are also significantly impacting the rural environment. So there are various features such as shoulders or multi-use trails that may have a significant environmental impact. And last but not the least, the effective consultation with stakeholders is required. It is mandatory. Let's look at the slide number 10. I have listed several technical studies that are required as a part of environmental assessment process. The main important studies from a public health perspective are, of course, safety, noise, air quality, and the impact on built environment. Now, let me illustrate with an example from Transportation Master Plan from region of Peel. So at the region of Peel, we are currently working on updating the Peel's long-range transportation plan. The main objective of the plan is to build community for life with a transportation system that is healthier, safer, faster, greener, and easier. So as a part of the LRTP process, we are following the environmental assessment process as stipulated by the Municipal Environmental Assessment Act. It is called Master Planning Process. This long-range transportation plan covers the phases 1 and 2 of the municipal Class EA process. Please recall the 5 phases that I was discussing earlier. Here we are following the phases 1 and 2 of the municipal Class EA process. So phases 1 and 2 involves defining the problem statement, identifying and evaluating the alternatives, and selecting a preferred alternative. The last stage is the design, construction, and implementation, and of course the maintenance comes into picture later. So this process can take at least 12 to 18 months with a public information meetings and consultations with stakeholders. I want to illustrate on the next slide 14. These are some of the alternatives that we evaluated. So for example, there's an alternative 1, alternative 2, alternative 3, and alternative 4. Full circle means it is the most preferred alternative, and quarter circle means it is the least preferred. So we are recommending the alternative number 4, which is a combination of aggressive transportation, transit demand measures, and a realistic or a practical road widening program. So the region of Peel realizes that the construction of new roads, while necessary, will not be enough to meet projected future travel demand. Therefore, there are various other strategies such as improvement in transit, transportation demand management, employing intelligent transportation system will be needed in order to address challenges that await Peel in upcoming years. So you can see these are the type of alternatives that need to be evaluated as a part of an environmental assessment process. And these alternatives have to be presented to public and stakeholders We need to take that input and move forward with the recommended alternative. With this, I want to emphasize how public health contribute to the environmental assessment process. The first and the most important point is the participation in stakeholder workshops and public consultation process. You can provide comments and your input on the built environment and the design of public infrastructure that people are healthy by design and adopt an active lifestyle. You can also refer to health development design guidelines or a healthy development index, such as one that we have developed at Region of Peel, and other tools can be employed as well. You can certainly highlight and promote the use of public transit and active transportation and link to healthy lifestyle and avoid, say for example, avoiding sedentary lifestyle that contributes to diabetes and obesity. You can also bring your expertise by understanding the process and bringing your valuable evidence-based decision-making approach to transportation planning. And I hear many times when I go to meetings about evidence-based planning, and that's an important element that could be incorporated into transportation planning. The last and the most important, you can assist in providing clear documentation as well as influence the outcome of EA. With this, I conclude my presentation, and it's time for our next presenter, Fisa. Thank you.
Thank you very much, Sabir, for your excellent presentation. We do have time for a couple of questions, but we'll also have time at the end of the webinar for more questions. So we can maybe respond, Sabir, to the first one that was posted on the chat box by Monique. Is there a tool or tools that Peel used to evaluate each of the components listed that help them arrive at their decision or recommendation?
So certainly, yes, at the Region of Peel, we have developed the Peel Healthy Development Index, as well as we have developed the design guidelines, which is called Regional Road Characterization Study. And we involve our Peel Health on a regular basis. There are regular meetings, and we include all the development guidelines as well as input from our various public health professionals into our study. So the key part is the involvement right from the environmental assessment process, at the beginning of the environmental assessment process, as well as developing the key design guidelines and tools. And I must also say that through Transportation Association of Canada, we are also developing a national design guideline, which will be available to everyone maybe by the end of next year. Thank you.
Thank you very much, Sabir. Again, if you have more questions, please add them to the chat box and we'll address them towards the end of the webinar. So for now, I'd like to introduce our next speaker, Fisa Wahid. Fisa is a health impact assessment specialist and an environmental risk analyst at Intrinsic. Fisa completed a postdoctoral fellowship in health impact assessment at the Dalla Lana School of Public Health at the University of Toronto. Her project was a rapid health impact assessment on the implementation of high occupancy toll lanes in Toronto. She has since worked on HIAs in the gambling and waste management sectors and also developed a framework for the Ontario Ministry of Transportation for assessing health in major new projects. Fisa is currently on maternity leave, and she is also a member of OPHA's Built Environment Working Group. Welcome, Fisa.
Thank you so much, Kevin. Can you hear me?
Yes.
Oh, perfect. My presentation, good morning everybody. My presentation today is going to highlight 4 basic points. Taking all the lessons that we can from what Sabir spoke to us today, I'm going to try and talk about how we can provide from public health perspective building evidence-based case. I'm going to do environmental lessons in the major research project. As part of building that evidence-based case, how can you use health assessment as a framework? So how do you decide that assessment is useful in a particular case? How do we focus on it? And how do we go about it with the evidence that we need? Next, I just want to highlight a very brief case study example of an HIA that was conducted as part of an environmental assessment. And a last brief point that I want to just simply mention is use of health in all policies as an approach, of which health impact assessment can also be a tool. All right, so to start off, as individuals who work in or are interested in public health, most of us are interested in ensuring that our communities develop and grow without compromising their health and sustainability. As our population growth steadily increases, there's a concurrent increase in the planning and development of built environment projects. These are major infrastructure projects that are built or redesigned to last for a few decades. And as a result, they have the potential to impact our health for a long period of time. And hence, like as Sabir mentioned previously, this is a great opportunity for public health units to get involved and influence how health is considered in these projects or policies. Next slide, I'm going on to slide number 4. Transportation, if you take that as an example, has broad impacts on health. From the perspective of public health and beyond just looking at it from a healthcare point of view, we can consider what these potential impacts might be when we look at the different travel behaviors and the different determinants of health these travel behaviors can impact. We can conduct an evidence-based analysis if we consider these determinants in light of the proposed project or policy and tease out how these things might change if the project were to go ahead. Or in other words, apply a health lens when we're looking at the different alternatives that are on the table. So for example, the project that I conducted not too long ago, if we were to implement a road pricing policy, how does that impact air quality and affect health outcomes down the line? What has research conducted on the subject shown previously? Have other health assessments been done on this policy elsewhere? So using all of this information that is available, we sort of like use it as evidence and build a case to say this project or this policy, if implemented with this particular alternative, has the potential to outcome health positively or potentially negatively in these ways. So we look at what air quality is like in a community currently, if you're thinking about the road pricing policy, for example, and how the initiative will improve or worsen things. And then also a health impact assessment, or if you're doing a health assessment on projects or policies, you can consider ways in which you can enhance or mitigate impacts as seen through literature or via case studies in other cities. So this next slide sort of gives you an overview of the different steps of a health impact assessment. But before I get into that, I would like to ask a couple of questions. The first one is whether you have heard of health impact assessment. And if the poll can be, I'm not sure if you can see the poll. Yes, you can. If you can pick an answer, either yes or no, that will be great. I understand as professionals who work in public health, there's a very good chance that most of you have heard of it, but I'm just curious to find out. Okay, I think that was the end of the poll. This is the end poll. Okay, so the next question is going to be a bit more specific, and I would like to ask if you've ever been involved in an HIA. HIA as a practice is still growing in Canada, so it would be good to know how many of us have had any experience in HIA. Okay. Great. So yeah, like I said, HIA as a practice is still growing in Canada. So it's good to see that, we've heard of HIA, but we've never really had a chance to be involved in one. So I hope that, this presentation today sort of gives you more of an idea of how HIA can be conducted, making it simple, and provide a couple examples of how HIA can be integrated within the process. So HIA framework that enables us to ask questions related to health impacts in a systematic and transparent manner, such that you can go about building that evidence-based case to lay out the potential health impacts of a project or policy. So the steps I'm going to go through one by one in the following slide, and we'll start with screening. So as you see what I've written down here, I call it the to be or not to be step. So this is where you decide whether to go forward, or you decide that it's just not worth it, or perhaps the project is too small, or perhaps there's not available evidence, information or time in which you can do an HIA. So initially, what you would do is just do a rapid assessment of relevant potential health impacts and assess what the scale of impacts might be. Are we looking at this particular road widening impacting like just a few houses on each end? Or is it something that might impact an entire community for a long period of time? So a decision on whether an HIA is useful, practical, or feasible for the project has to be made in the screening phase. And you would look at things like time. Do you have the time before a decision is made to conduct an HIA? Do you have the funding? Do you have money available? Do you have resources? Do you have individuals available who understand how an HIA works, or can learn fast enough in order to conduct even a rapid health impact assessment? And another really important element in the screening step is trying to get a handle on whether there is enough information and data available to even do the assessment. Oftentimes, this is a major, problem that we face. So the objective in the screening phase overall is to determine if an HIA is the best way to assess potential health impacts, and whether these four things, the TFRI as I like to call them, elements, are optimal and provide a chance for us to go over. Sorry, I see that sound is cutting in and out. Is it still really bad?
No, it's fine.
It's fine? Okay. I'm going to go on to slide number 7, scoping. Noise issues here. Okay. Is this noise on the phone line, or is this noise on the computer audio? Okay. All right. So moving on to the scoping phase. For the scoping phase, the second step of the HIA, once you've decided that, from the screening that yes, an HIA is helpful, it is useful, and we have the time and resources to go ahead with it, you would scope the HIA in terms of providing a blueprint for how the assessment is going to go. So the scoping step would then consider what data and information is available to build an evidence-based assessment, whether you would have to pay to get this data, whether this data is freely available. You would look at practical considerations about managing and organizing the health impact assessment. And very importantly, you would go about getting feedback from stakeholders and include community concerns related to the project or policy, because this is when you will select, the determinants of health that are relevant or most important for this particular proposed project, and the potential vulnerable populations that might be affected. So the overall objective is to determine key areas of concern when you're doing the assessment and focus on them. So, I mean, this is where many people would go wrong, because, of course, when you're looking at a proposed project or policy, there are a myriad of concerns. If you have stakeholders from different sectors, have 10 different concerns, but you don't have the time or even the money to go around looking at each of these in an in-depth manner. So you would have to seriously sit down and consider if this is the proposed project, air quality, access transportation, we have health equity. These are the things that are most important as described by the stakeholders. And these are the things that the project should focus on. Slide number 8.
Hi, Wahid, sorry about that. Interrupt. The slide previously, there was something technical difficulty. If you could go back to that slide, we have time. So I think we didn't get to hear that.
Can you hear me?
Can hear you now very good, but we lost you for a
I'm
little.
not sure what's changing.
It's good now.
Okay, it's good now. Okay, all right. I will. I'm using a landline, so it's difficult for me to tell what's going on. Okay, I will stay in exactly the same position. Looking at slide number 7, you were saying, Kevin, that I should repeat what I was saying?
Please.
Okay, so if we're doing the scoping step of the HIA, scoping provides the blueprint for HIA. So this is where you would select the determinants of health that you would like to focus on and stick to pretty much the outline or the map that you create in this phase. Also during scoping, it is incredibly important to take feedback from stakeholders and also include community concerns as to what people are most concerned about when it comes to the proposed project or policy. On slide 8, we're looking at a figure that outlines the social determinants of health. The determinants of health form the basis of any HIA. These are the lens through which the assessment is conducted in order to understand potential impacts to health and well-being. And they are selected during the scoping step, as I mentioned to you. The HIA process recognizes that health and well-being can be impacted by a wide range of factors, as it follows the definition of health laid out by the World Health Organization, that health is not just the absence of disease or infirmity, but it is holistic overall well-being. So we look at some determinants of health related to physical, environmental, social or cultural, economic, as well as biological well-being. And this slide, number 9, actually looks at some examples of determinants of health that public health units in Ontario highlighted were important to them when they commented on some EAs that were brought before the public health unit. So I'm not sure if how many of us at this webinar 2 were listening in on webinar 1, but Lorenzo Mele from Peel Region Public Health talked about a survey of public health units that was conducted by the Built Environment and Health Working Group, where we asked public health units to sort of mention what were the broad topic areas related to health that they brought up during the EA process. And as you can see, air quality, community safety or injury prevention, active transportation, water and soil quality, climate change impacts were some of the determinants of health that were raised by public health units when they were participating in comments during the EA process. Moving on to stakeholder engagement. Again, as I mentioned to you before, and it's not something that I can highlight enough, but this is one of the integral parts of an HIA, and it is one of the core principles. Sorry, I am getting close to the microphone. I hope sound quality is still good. So a multidisciplinary group of stakeholders is often involved during the scoping process. So one can understand from different perspectives what are the potential impacts to health that a project may have. So you would not just have the project proponent, you would have local health authorities, subject matter experts, community representatives, including First Nations representatives, representatives from government, academia, and etc. And you would want to provide multiple opportunities for input, including steering committee meetings, scoping workshops, as well as you move down through the HRA process and as you're heading towards making recommendations, also include stakeholders to provide input on those recommendations as well. So when you include stakeholders to provide input, it ensures that when you're selecting the scope or as you're going about making the recommendation, your selections and your recommendations are unbiased. And then the assessment itself will then be based on best available evidence and input from those who have the local knowledge as well as expertise. So slide 11, I have another poll for us. So this is from the city of Barrie. They have posted a master plan update on their multimodal active transportation master plan. If you look at something like this in your public health, you come across this. As say, for example, you were able to find on this multimodal active transportation master plan to relevant to your public health unit. Would you consider an HRA or similar type of assessment when you see this to provide your input? I'd maybe give you like a minute to decide or take a look and give an answer in yes or no. So I mean, just to draw your attention, if you look at the screenshot that I've taken, at the very bottom it says key considerations are developing plans to increase active transportation and transit use, improve options to keep Barrie moving during plan growth, and developing comprehensive environmentally sound solutions. Great. We have one person who would not consider an HRA or a similar type of assessment to provide input. I'd be very interested to find out why. Okay. Moving on, I think, next slide. This is the step following the scoping. So once you've established the blueprints for the HRA and you know what are the main things that you're going to look at, you would jump straight into the assessment phase. The first part of an assessment phase is building a baseline profile, a baseline health profile, or a baseline community profile that outlines the current conditions in the community. So you compile data and information on the community as it stands today. And this you need to better understand key issues faced by the community. And then you focus on the baseline, on the determinants of health selected during the scoping process. So for example, going back to that example, if we're going to implement transportation pricing, if we're going to implement pricing on highways in a particular community, one of the things that we will look at is air quality. In this particular community, what is the air quality currently like? Do we have a lot of asthma or respiratory disorders in this community? Will this policy or project further impact the air quality here? And if it is negatively impacting, are there ways in which we can mitigate these impacts? So those are some of the things that you can try and infer if you have a baseline profile that you have built up. In an assessment, you identify and then describe potential impacts using information from the following sources. If we're talking about an HRA that is being conducted as part of an environmental assessment, this is absolutely great because you have EA material that is already available to you. As Sabir mentioned earlier, an air quality assessment is normally one of the studies that is conducted during an EA. So this is material that is readily available to the HRA team. So if you have similar assessments that have been conducted on a similar type of project, that's again information that's available. The scientific literature, both the peer-reviewed and the gray literature, and what information there is from there. And again, input from stakeholders and the community. So using all of this evidence that you collect, you can assess the significance of the impact. Slide 13, going on to the next step, which is making recommendations. Once you have sort of done the assessment and you've looked at what the potential health impacts are, and you have discerned what the significance of these impacts might be, you move on to making recommendations that are practical and feasible changes that can be made to improve health and mitigate any potential negative health impacts that may arise. The key here is to make a few recommendations that are both practical and will have the most impact. So it is easy to make maybe 20 recommendations looking at, 10 different, many different things. However, what are the chances that all of these recommendations will be implemented? We have to understand that, when we're providing our input and we have an evidence base that we've created, what are the key points to hit to make sure A, these recommendations are actually adapted within the new plan, and B, they can be easily implemented. So at this stage, again, it is really important to utilize feedback from stakeholders to fine-tune the recommendation. And going on to the next step, which is reporting. Again, results to be produced not just in a full-length HR report that has a lot of technicalities and so on, but also consider the use of simple fact sheets and one-pagers, which has information that is easily disseminated. And as I move on, I see a question about recommendation and whether the costs speak to the recommendations, and definitely that's a definite yes. So again, that goes into the feasible recommendations category, right? So I mean, it's not just practical, but it should be feasible. So definitely a point to consider. And in summary, the objectives of HIA. So this is something that I should have talked about in the very beginning, but I always talk about at the very end, because after having looked at all of that, it's important to realize ultimately that the objective of an HIA is to provide transparent evaluation of the potential positive and negative health effects associated with the proposed project or policy. Key word here is transparent. Next, an HIA provides a series of evidence-based recommendations that reflect the findings in the assessment. Evidence-based and the findings should sort of correlate with each other. And last but not least, a really important point is that an HIA is not intended to be used as an advocacy tool, but to decide whether, if a project should proceed, how can health and well-being be protected or enhanced. So as I promised, I pulled up an example of an HIA that was conducted as part of a wider EA. This was in Los Angeles. Alas, we don't have an example as of yet in Canada. Soon we will. It's an HIA that I've been working on as well. So this was something called the Gateway Cities Air Quality Action Plan. And it was an HIA that was voted on by the I-710 Corridor Project Committee that said an HIA should be conducted. And the aim was to assess the proposed corridor project alternatives and to evaluate selected health determinants to assess health outcomes linked to proposed actions of each alternative. So it sort of correlates with what Sabir was talking about and how our environmental assessment process works, where we have different alternatives that are on the table. So this particular HIA looked at each alternative and how the alternative impacted health outcomes. So the determinants selected in this particular I-710 HIA were mobility, air quality, noise, traffic safety, jobs, economic development, and access to neighborhood resources. Some of the findings include, compared to baseline, they found that the alternatives under consideration were likely to lead to mixed health impacts. So there were some positives as well as there were some potential negatives. I'm not going to read them, but these slides are available, so I'll leave you to read them later. And then the key recommendations were these. So one of the main ones was to adopt or advocate for policies to reduce automobile and truck usage. So from following up from what Sabir was saying earlier, that not just building roads is not enough anymore. we also need different transportation demand management strategies in conjunction with, widening roads or building new roads. The key recommendations I'm going to leave here, and you can take a look at that if you're interested. But again, these are all very common when you look at this particular type of project. So the lesson here is probably that if you're thinking about doing an HIA and you've never done one, there are many different examples dealt with similar projects.
Fisa, we lost you there for a couple of minutes.
Is it still very bad? Can you hear me now?
No, I can hear you perfectly now, but just your response, I think, to that you were speaking a couple of seconds ago, we just lost that part.
Oh, I'll just repeat the last sentence then. When we're considering the recommendations and when we're looking at this particular example, where we're looking at, even if in Canada we have into health impact assessment a lot, and we have not conducted health impact assessment, I would think that there are examples of similar projects in cities similar to the Greater Toronto area where health impact assessments have been done and can be used as case studies for our projects over here. Okay, so I'm almost close to finishing up. And slide number 17, I just wanted to mention something called Health in All Policies approach. So this is something that the National Collaborating Center recently did a webinar on. And Health and Policies approach sort of works towards improving both health and equity across different sectors and across different levels of government. So it's a systematic approach. It applies a health lens to all policies, in different sectors. And more often than not, HIAP approaches do use health impact assessment as a tool. And again, as health impact assessment does, HIAP approach looks at health more as just the absence of disease or infirmity. So it considers health beyond just healthcare, so looking at the social determinants of health. And it uses evidence as the foundation of all policy-making exercises. So I've listed the website there where the webinar is available in case anyone's interested. That is the end of my presentation.
Thank you very much, Fisa, for that excellent presentation. There is a question that was posed by Charlotte, and she's asking, many of the dimensions of an HIA, jobs, neighborhood, resources, are what we would look at in a social impact assessment in an EA. How would you distinguish HIA with an SIA? In HIA, we'll also look at what the health outcomes of that are. So we're looking not just at the direct impact, but at the indirect impact as well. Jobs impact health. Availability of jobs impacts health. Neighborhood resources, whether we have access to healthy food sources, whether we have access to, daycare centers close to where we are, what kind of obstruction is available, is present in our communities. All of those have health impacts. So not just looking at how this impacts social relationships, we also look at health impacts of that. And yes, social impact assessment, if it's conducted is also information that can be pulled into an HIA so that there's no duplication of effort. Okay, great. We have another question. Do you have any recommendation in terms of guidance documents for doing an HIA?
There are many different guidance documents for doing an HIA, but I think it will be possible for me to put up a few links, and I think that would be available on the OPHA website if it's okay, Kevin?
Yeah, sure.
Okay, so there are several different guidance documents and other sort of assistance documents available for when you're conducting an HIA. I could put up links or just direct PDF files and make them available so that they're on the OPHA website in the same place where we have this presentation.
Perfect. We have another question, Fisa. So relationship building is imperative in catchment areas that are not part of a regional government where health units cover multiple municipalities. Can you comment on this? Is this not the first step where public health is only one of the stakeholders?
Oh, absolutely. So this is an HIA that I've actually been working on. It's sort of a waste management facility where the public health unit is responsible for the smaller area, but they're a wider public health unit. So what we have is we sort of also look at local experts who have expertise in like the smaller areas as well. So definitely that is a very great point.
All right. We have a couple more minutes, and I just had a couple of questions for Sabir as well as Fisa regarding any recommendations that you can provide for training and developing expertise around EAs and HIAs. So I know we did mention, Fisa, that you're going to send some links for resources, but you know, I'm really interested because basically health units are going to have to develop that capacity, that expertise, and if there's any suggestions around that, around courses that you're aware of, would you like to include that in the guidance document?
Sure. As I mentioned, collaborating with information and resources, not just on quality, but also have information on there are, I believe, a few YouTube videos in which they do talk about this. Also, apart from that, you know, I will be putting up some guidance documents that one can read through. And I think also my company, Intrinsic, is working on a framework for health impact assessment that can be used by Health Canada going forward in impact assessments that will be done federally. And I think that will also be available to everyone nationally soon. And if you're talking about Kevin, just doing webinars to practically talk about this, or?
No, I'm looking at developing that expertise within each health unit so that, you know, when these opportunities come across and we're more, we have that capacity, that ability to, you know, to participate in this, because I think some of these processes can be time consuming and we're resource limited in some respects. So I think, you know, building that expertise and that ability to participate, I think, is really important moving forward.
True. And now, I mean, I completely understand that, because when I was doing my postdoctoral fellowship, I mean, there were no health impact assessments being conducted. So I thought the best way I would learn is to do one myself. But that was as a part of a project. I mean, I have the site funding, so that's easy to say. But, I mean, you know, if one ever has a chance to do a rapid health impact assessment or participate in one or enact an exercise of an HIA, I mean, they're all learning exercises. And there are several webinars, you know, guidance documents and everything that are available that one can look at. Health impact assessments have been published on many different projects across different sectors. Reading something like that would also help us understand. I mean, just looking at this one example that I presented, I didn't even really go into it, but looking at that, I mean, you can understand this was a comprehensive HIA. So it really, you know, dives deep into the different determinants of health, goes into different evidence sources, actually collects data. So as part of the evidence-making exercise, it collects data. So, you know, there's different resources available that one can read. But again, you're right, it's time-consuming. So unless we don't have legislation that sort of compels us to do HIAs or do health assessments, I'm afraid that the push to understand and do HIAs will be entirely voluntary.
Okay.
And Kevin, in terms of environmental assessments, the federal government as well as provincial government have an excellent website. So you can find certainly the information on environmental assessment, both from the federal as well as provincial government environmental assessment website. Municipal Engineering Association has good information on Class EAs. So this information is also available online on their website. And apart from that, Ontario Traffic Council also hosts a workshop every year on the environmental assessments. So there are various ways to get input and information on the environmental assessment. Plus, you can also view certain examples of environmental assessment on Region of Peel, Region of York, City of Toronto, and many other organizations' website as well.
Okay, great. Thank you. I have another question. This is for Sabir. Just so becoming more aware of environmental assessments, we know they're happening, and some of, like, for instance, an individual EA, they're directed to a medical officer of health, whereas others are not. Any recommendations on how we can, you know, become more aware? Like we know transportation's leading certain projects, but how we can become more informed in that process? Any suggestions from your experiences?
Yes, so Kevin, certainly. The environmental assessments, they begin for various types of environmental assessments, such as individual environmental assessment or a streamlined environmental assessment. They all begin with a notice of project commencement. So from the very beginning, if a transportation department is leading an environmental assessment, the health department should certainly make a point of participating from the day one on the environmental assessment.
We have one more question. We have time for one more that I see that's been posted. How did an HIA originate? Did they stem from an EA?
Oh, that is a great question. It goes into the history of HIAs. I don't think they stem from EAs, but I think they stem from probably in the UK. I think this is where they started, and this is mostly public health units who sort of decided that they were more interested in looking at, you know, health outside of just healthcare. So health is not just the absence of disease or infirmity. It is more than just that. So I think, like, you know, smaller assessments, and then, you know, the different sectors from government and private sectors got involved, and the name health impact assessment became known. But I think these are assessments that have been done by health units over time, and they just never had a name before. But it slowly evolved into this framework, which has now become popular, and there's several different frameworks available. But I think it's not just EAs. They came from public health units trying to do, you know, their bit for health. But I think there's a history document that actually talks about, like, what the origin of HIA is. That will also be one of the resources that I will post. Great question.
Okay. Thank you very much, Fisa. So yeah, we're wrapping up time now, so we're towards the end of our webinar. So I just wanted to give some final thoughts, and I'd like to thank everyone for attending our OPHA webinar, and special thanks to Sabir and Fisa for their excellent presentations. We'll certainly follow up with those links and those recommendations that were brought forth after the presentations. You can download those Fisa and Sabir's presentations. We had a question about that. They are available now. We'll also be posting copies of the presentation and a recording on our OPHA website, as well as you can access our first webinar if you didn't have a chance to participate. So we're in the process now of planning our next 2 EA webinars, which we hope to take place early in the new year. So please stay tuned and visit our OPHA website and consider joining our listserv as well as our work group. So we're interested in hearing more feedback around our involvement in EAs as well as HIAs. So I'd like to thank everyone again for participating and connecting with us. And we look forward to connecting with everyone again in the near future. So thank you.